All right, right now there are more than 1 million people living in the United States with HIV. Research shows the Deep South has the highest rates of HIV diagnosis.
While advanced treatments have made it possible for people with HIV to live normal lives and not to pass the virus to others, stigmas continue to plague people living with the disease and those fighting it. In this afternoon's Stronger Houston report, KPRC2's Devin Clark explains how we can all do our part to end the epidemic.
I was so depressed at the time, I had no thought process of it. And really, I was preparing myself to die.
31-year-old Marnina Miller has been living with a human immunodeficiency virus, or HIV, for 8 years now.
When I got to Texas Southern, I started dating a guy, and we got pretty serious. And about a year into our dating relationship, I thought, hey, let's go get tested together. And when we did go get tested, we found out that both of us were living with HIV.
She says she's never experienced the flu-like symptoms that can accompany the virus.
But what I really had was my women intuition.
But what Miller immediately knew she did not have was her partner's support.
It's pretty traumatic. He actually left me at the clinic.
For 2 years after being diagnosed, a fear and lack of understanding prevented Miller from seeking treatment. A study called The State of HIV Stigma, released this year by the Gay and Lesbian Alliance Against Defamation, or GLAAD, shows that less than half of Americans feel knowledgeable about HIV.
When I first started treatment, I was scared, as a lot of folks are, and I was really nervous about how that would affect my body.
Like others who began HIV treatment, within months, Miller became undetectable, which means her viral load was so suppressed she can't pass HIV to her partners. On the other hand, Marcus Stanley, who works for the Sustain Center, which is focused on connecting people to resources dealing with HIV, says there are so many others here in the Houston metro area who continue to be affected by stigmas and ignorance and never get the help needed to stop the spread.
Here in Houston, there's a little bit over 29,000 people identified that are living with HIV. About 75% of them have actually made it to one medical visit. However, from that from the 75%, only about 60% of that 75% is retained in care.
Stanley says minorities and those in lower income areas are disproportionately affected by the virus.
Where individuals live, do they have accessibility to actually go to those appointments? Do they have access and accessibility to actually afford that medication? PrEP is a medication that individuals who are HIV negative can take to prevent themselves from becoming HIV positive. There's about a 96% prevention rate.
As far as treatment for people already living with HIV, in addition to daily pills, there's also now a once-a-month injectable medication.
I think us as an organization, us as a community in the HIV field, we have to do more in order to reach individuals where they are.
Miller agrees. She works with the Southern AIDS Coalition as an outreach coordinator.
I'm now happy, I'm healthy, I'm undetectable. I now have 2 amazing nieces that I love, and my life has come full circle.
The Houston Health Department reported that as of 2018, there were nearly 7,000 people living in our area with HIV who don't even know they have it. And we should also mention that you can have HIV for up to 10 years without showing any sign of illness. We have a list of resources where you can either seek help or get informed on our website, clicktohouston.com. Devin Clark, KPRC2 News.